Thank you so much for joining us today for the United Health Foundation National Medical Fellowships Diverse Medical Scholars Program Information Session. My name is Tanikia Jackson, and I am the Program Coordinator here at National Medical Fellowships. And I've been at NMF for 2 years at this point, and I want to say this is my third program cycle with the United Health program. It's one of the programs that I'm very familiar with. I love it. I love the projects that come out of it. They are often really impressive and do a lot to help the communities that our scholars are in. It's really great when medical students who are very close to medical professionals can share their knowledge and information and often give time to people in communities that are not able to get that face time with doctors. So let's get started, and I'm going to tell you about the program. So a little bit about National Medical Fellowships. NMS, obviously, we provide scholarships and support to medical students who are underrepresented minorities. And we do this through 2 ways. We do it through offering service learning programs and scholarships. Our scholarships are just a financial award that we give to students, and it's typically somewhere between $2,500 and up to $7,000. And those scholarships go out. There's no extra requirement for most of them. Then we have our service learning program, which in addition to having a scholarship with it, you also have to complete a community service project. And as we know, a lot of medical schools require that their students do some sort of community service project. And so in many ways, NMS is sort of giving you a financial incentive to do things that you are already doing, which is really great because we know that as medical students, you are busy, you have a lot of things that you're taking care of, but at the same time, a little extra money can go a long way. And I also know that some of you are very passionate about helping underserved communities or helping on a community level, and this is a great opportunity to support that work. So we don't have requirements on how our scholarships are used, which is nice. Some of our scholars use their scholarships to take care of their personal finances or tuition and things like that, and sometimes they use it to go towards the projects that they are doing in order to get the resources and materials that they need. So it's nice that our awards are kind of flexible in that way. So this particular program invests in underrepresented minority health professionals and communities. It develops future leaders in the medical field and promotes community involvement. It also supports community sites and their constituents, because the work that our scholars do at the community sites, time and time again, we hear from the sites and from the mentors how impactful that work is and how much it's really helped them to further their goals. So each scholar, when you, if you are selected as a United Health Scholar, you receive a $7,000 award. So we are happy because United Health, this is their 4th year with us for this program, and it has consistently increased in the number of scholars that we have had. So this year and last year were the same because they are under the same renewal contract. So we have another 30 scholars who will be selected, and you have to meet the following eligibility: be a U.S. citizen or be DACA status, and DACA is Deferred Action for Childhood Arrival. And if you have the DACA status, you know that you have to provide proof of that. That's something that we are newly instituting. We're very happy to be offering it because we realize that there are a lot of opportunities that are closed off to students who have that DACA status. You have to identify with one of the following underrepresented minority groups: African American, Latino, Native American, or Asian American. Asian American is limited to Vietnamese or Cambodian. And our sort of categories that we choose for the underrepresented minority groups mirrors what the AAMC has stated are underrepresented groups of doctors. So now we don't just look at who's a minority within the country, but we look at who's serving minorities within the country and which groups are underrepresented medically. We want you to have demonstrated leadership at an early stage. We do look at this in your application, and we want to see that you are involved with volunteer work, that you have started some things, you've led some things, you've come up with ideas. All our scholars really sort of run the spectrum of being leaders, which is great, and we want to continue to foster and nurture that and give you added opportunities for that. We, of course, want people who are committed to serving medically underserved communities. NMF is not just looking to have an impact today, but we're also looking to have an impact in the future. So as great as it is that someone may start a project with National Medical Fellowships, we really want someone who's going to take the skills that they get here and continue to apply them as they go into their career. So you're always sort of looking at helping underserved populations. You, of course, have to be enrolled in an accredited medical school and attend medical school in one of the targeted locations. So let's go over our targeted locations. And one more thing about this, scholars who successfully complete the program are eligible for renewal. So if you are in the program 1 year, then you can renew your scholarship for the next year without going through the whole application process. This year, I believe, of the 30 students who were in the program last year, we have 10 that we know are renewing. So at this point, we are probably looking for about 20 new scholars, to give you an idea of that. These are the locations that we're looking for. In Arizona, it's Phoenix, Arizona, Orlando, Tampa, or Miami, Florida, Atlanta, Georgia, Albuquerque, New Mexico, New York City area, which includes New York, Connecticut, Pennsylvania, and New Jersey. And within New York is really sort of looking around the New York City area, not so much upstate New York. Nashville, Tennessee, San Antonio, Texas, which Texas is my home state, just so we all know that, and Milwaukee, Wisconsin. Okay. So here's a little information about the community project. You do have to complete a minimum of 200 hours. It needs to be something that you are coming up with. When we say self-directed, we mean that you're setting the goals for it, you're doing the work, you're really generating the energy behind it, and not just like doing administrative tasks for it that someone else has put into place. So we want things that are innovative and that are sort of changing things up or looking at what's new in meeting needs for these underserved communities. And then it also should, of course, reach an underserved by a community group, so, as I've talked about. Here are a few examples of projects that other people have done, and they're not always necessarily specifically health-focused, but in a lot of them they are. Reducing the risk of psychiatric medications through patient education, health disparities for women in inner city, health plan marketplace project, and the Cascade Mini Med School Initiative. And the nice thing about the Cascade Mini Med School is that this program has actually been with us for 3 years. They're an excellent example of renewal scholarships. And it's actually a team of 2 students who I believe go to Rutgers in New Jersey, and they have created this sort of mini med school and really kept it propelling, and because it went over 3 years, they have gotten to a point where it's sustainable. They are both, I believe, leaving the program this year, and they have like solid leadership in place for it to continue, which is, again, one of the things that we really want to see, because it's not a one-term impact that we're trying to have. We're trying to have something that's much more sustainable. So with our program, we ask that you, in the end, do a PowerPoint presentation, and I'll just walk you through one of these, both to show you what that PowerPoint looks like and also to give you an idea of the type of project. So This was done by Karen Mendez, who is a New York student at New York Medical College, and her program actually took place at a women's shelter in New Jersey. So she has some information here about Paterson, New Jersey. She talks about the population, as well as a little bit of the financial disparities that are there, which are causing the problems that she hopes to intervene in. So she talks about the site, which is, of course, really important. This particular one has 17 beds for women and children. They provide transitional housing with an average 90-day stay. They give classes in food, electricity, housewares, financial literacy, and it was founded on the desire to help women transition to independent living by providing a series of weekend workshops that focus on self-development. And that's really what her project did in order to help the site where she was. So she looked at the site, she looked at what they offered, and she talked to them about what they needed, and the best thing that they could come up with, or in her case, was to do these weekend classes that focus on self-development so that eventually she could help them meet the goal of having these women and children go to an independent living situation. So her methodology is here. Program was 6 months. The themes were selected to complement each other. She used hospital staff. She worked with an excellent hospital in New Jersey. I was very impressed when on a site visit there. Had a great opportunity to speak with her and her mentor. Here's some of the topics that she did: healthy sleep, healthy diet, job readiness, self-esteem, and personal hygiene and infectious disease staff. So those are people from the hospital. And she talks about when the sessions were held. And then she gives information about her findings. She says, no formal evaluation method was in place through the project to assess the outcomes of the initiative on a per workshop basis, but she did have positive reviews from the Paterson Task Force at St. Joseph's Regional Medical Center, and the residents from both shelters were engaged and actively participated. So though she didn't have any specific numbers about how her program actually increased or helped to meet that final goal, she was able to put it into place. She was also able to see how the residents engaged, and she received some anecdotal feedback on how the workshops impacted the residents of this community. And for me, in talking with the site mentor, I heard some really great things about the impact of this particular program and some specific examples of skills that people learned or ways that it changed. So since Karen is very possibly renewing, I believe she has submitted her renewal application for this program, one of the things that she might want to put into place for this next year is to actually go ahead and put in that formal evaluation piece. So when we look at renewal, we also look at what can you do to make the program better. This year she made it happen. This next year she can take it further. So here are her conclusions and recommendations, and then acknowledgments. Okay, so that's what a community program could look like. That is just one example. It's not necessarily every program doesn't need to be that way. As you can see from the list, there are a lot of different ways that programs can go. And one thing that I want to show you really quickly, so on our website, nmsonline.org, we actually have under the Resources tab a list of all of the projects that have been done, that were done in 2014, and this is going to be updated soon to include this last year's projects. And what they show are just different projects that people have done and ways that they found to tackle a community issue. So if you have questions about what can I do or you need ideas, this is a good resource for that. Okay. And that's on our website, NMS Online. So in the program, you have a site mentor, which you choose. They should be someone who is at the site, typically someone who knows about the population or who knows about the particular problem that you're trying to tackle. A lot of scholars also find it really helpful to have someone that they're working with at their school, like a faculty advisor, to give them more issue-specific guidance. So if you have questions about, how do I address diabetic needs within a youth community, or how do I best help women to become better sustained or more independent, then talking to a faculty advisor is often a good resource if that's their area. So you want to find someone who pairs well with that area, in addition to the site mentor. A lot of times working at clinics or even the shelter that Karen was at, she was able to find some really good mentors within that site because they work with that population all the time. Monthly reporting is something that you have to do. So each month you have to just submit a report that gives an idea of what you did for that month, and also gives an update on the number of hours that you completed for that month. 200 hours seems like a lot, but spread out over 4 or 5 months, it's not that much as long as you're consistent with it. And the things that count with monthly reporting are any planning that you do, meetings with your mentor, and the implementation of the program or the project that you do, as well as follow-up. The only thing that doesn't count towards that 200 hours is the analysis at the end of the program, and so we'll talk about that. I think we talk about that in just a little bit. Oh, the final reports. So, which analyzes and documents your project and results. As you saw in Karen's presentation, she went through the methodology, she went through her findings, she went through conclusions and recommendations, and that is an example of what that final presentation looks like. But the 200 hours cannot come from writing that or putting any of that together. It won't count towards it. So you will attend the culminating event, which facilitates the discussion of your project and the sharing of ideas. And then as a United Health Scholar, the United Health Foundation puts on a forum for all of the medical students that they fund through scholarships, which I think our group is the only group of actual students who are in medical school, and the rest of the scholarships that they give are mostly to undergraduate students, and then they have a few to, I think, rising undergraduates and people coming out of high school. And so it's really nice to see the variety of people who are looking at and pursuing medicine, and they also offer some really good workshops and things to give you skills that are really helpful to building your career and building your skill base. So the culminating event and the forum will take place together. We're not exactly sure of those dates yet. We haven't heard from United Health when their forum will be, but that'll probably be available once we select scholars and all of that. So the application, all of this information about the application can be found online. If you have questions about the application, I'll take them in just a few minutes once we finish, but here are all of the elements of it. Transcript, student aid report, which is an NMF form. It is generated when you start your application online. You'll see a place where you can put in the name and email address of a person in your financial aid office, and we send the form to them, and then they can submit it back online. So you want to make sure you track who gets it so you can follow up with them and make sure that that gets in. Verification of citizenship, it could be your passport, it could be your birth certificate, it could also be your papers if you've become a U.S. citizen. It could be, for DACA students, there would be the DACA letter stating that you are DACA eligible. And then we need your financial aid transcript. Oh, I switched these up, I'm sorry. The financial aid transcript is the one that you would send an email to someone in your financial aid department for. The student aid report is the form that you get from your FAFSA. 2 personal statements, and on the website it says very clearly what those questions are. the community health project proposal. So when you apply, you need to know the project that you want to do. You also want to have an idea of the site where you want to do this project. Again, just like Karen went to that homeless shelter and she found out what they needed before starting to plan her project, that's a really good idea for a way to choose a topic, is to find a place where you want to do it, see where the need is, and then get involved with that need. Your CV, your resume, a bio sketch, there's an example of the bio sketch on our website, 2 letters of recommendation. 1 letter should be from a dean at your school, and then 1 letter should be from your, it should be from a site where you have volunteered. So it should be a person who's familiar with you as a volunteer, with your volunteer work. If you are an undergraduate student, or if you're, let's say, not an undergraduate, but you're starting medical school, this is your first year, you don't really know anyone yet, we will accept a letter from your undergraduate or your master's degree program if you don't feel comfortable asking for one from someone from your medical school. And then the documentation of your loan history. Okay. Now we have time for questions. Just so you know, if you ever want to get in contact with us, the best way to do that is through email, which is scholarships@nmfonline.org. And a quick note sort of about this, there is a number that's here, and we try to respond by phone. But in the next, 3 weeks or so, it's going to be, the office is going to be a little bare, so email is really going to be the best way to contact me if you have questions, and I'll be sure to get back to you within 24 to 48 hours, but email is really sort of the way to reach out to us right now. Okay, so if you have questions now, please type them into either the chat box or the Q&A box, and I will be happy to answer them. So someone has asked, when should we begin our project if we are accepted? So the project, we hope to send out our acceptance letters by the beginning of October, and then to have the orientation mid-October. So after orientation is when you can start your project. So I would plan for about October 20th or something like that. And I give kind of a range of dates just because sometimes we have to leave a little time for making sure we get in all of the scholars. We have all high-quality scholars as well. Awesome. Someone has asked, is it possible for a project to span multiple years? When you say, is it possible for it to span multiple years, do you mean like having different phases, like if you have different phases that you want to implement, or like are you asking if we can approve you as a scholar over multiple years, or what exactly? I'm a little confused by the question. Okay, well, I'll wait for clarification on that question. I have another question that says, is there a timeline as far as the minimum or maximum length of the project? So the project absolutely has to meet that 200 hours, and it has to be within the span of the program. So typically the program starts in October, like I just said, and then it needs to be done by May of next year. And actually your work should be done at the beginning of April, and then you have the month of April and May to work on your final projects and such. Within that, I want to say that there is some flexibility, just because, again, we don't want to necessarily limit your project to the range of this program, because we want you to do a project that actually helps the site, and a project that gives you what you need as well. So if you have a project that goes past May, what we would ask you to do is to, or goes past April, what we would ask you to do is to report on what you've done so far. So you may not have all of your evidence, but you have some evidence and some information that you can draw conclusions from, and that's what we would ask you to do. And as far as the minimum amount of time, like I said, it has to meet that 200 hours. We do want something that is continuous, not just necessarily one, day-long event. That's not really what we want to promote. Gabriella, let me know if that answered your question or if you need a little more clarification. Okay. And I think it's possible that my last answer may have answered the question about the project to span multiple years. If you would let me know. Okay, great. Excellent, it did. Okay, awesome. Do you have any additional questions, any questions about the application or previous projects, or I think we kind of talked about renewal. Awesome. Okay. So if you find that you have questions as you move forward, like I said, be sure to email us at scholarships@nmfonline. I have one more question. It says, does the project have to be completely new? So the project doesn't have to be completely new, but you do have to have specific ways that you're trying to expand or change something about the program. So again, it's great when there are programs that are up and running, but we really sort of want to fund things that are looking at meeting a need that hasn't been met, or meeting a need that may have been met, or that there are ways to meet it, but like you're doing it in a new way. I hope that made sense. That sounded confusing to me. But essentially what I mean is that you're attacking maybe an old need that has not been solved in a new way, if that makes sense. So let's say I have a student who is thinking of taking over a project, and the project is dealing with teen girls and sexual health. And so this project was put into place actually by a different United Health scholar who's graduating this year. And some of the things that the new scholar is thinking about doing include expanding to a new location. She's adding some different areas to the curriculum that they are looking at, and those count as expanding upon a program. So it's not completely new. She's not starting all over again, but at the same time, she's not just carrying out a program that's already there. Awesome. And so I'm just going to point out again the resources we have on the NMF website. There is the resource library, as well as there's a list of frequently asked questions that I want to point out really quickly under scholarships and awards, service learning programs, United Health Foundation. So over to the left, there's actually two things. So the application checklist, which gives detailed information about some of the things that we ask for, really answers a lot of the questions. Looks like this is for the California Community Service Learning Program. I wanted to go to the one. Okay, so really detailed information on the things that we are looking for, as well as tells about the questions that you'll have to answer for essays. So that gives you that information. And then the other thing that I want to point out is just our frequently asked questions page, and a lot of the questions that you may have about eligibility, filling out the application, any of those things can be answered here. So we've really tried to think ahead about what you need as a student who's applying for our scholarships. Awesome. So check out our things. We look forward to getting your applications. I look forward to hearing from you should you have any further questions. And I hope that this has been a very insightful and useful webinar for you. All right, have a great night. Thank you so much for joining.